Minister Pasqual, turning to you, Sri Lanka has always shown resilience and adaptability in its public health strategies. Can you share what Sri Lanka is doing to accelerate action on mental health with an intentional focus on groups who are exposed to vulnerability and adversity, as well as different age groups?
Excellencies, ladies and gentlemen, in my speech, I propose to implement 3 programs in Sri Lanka and around the world. Namely, first one is implementation of happiness index to develop eternal love, not material love. Second one is I propose to implement contributory and mandatory pension scheme for all self-employment workers in Sri Lanka. And third one is implementation of skill-based examination system instead of subject-based examination system. I am honored to represent Sri Lanka at this 5th Global Mental Health Summit held under the theme Mental Health in All Policies. In Sri Lanka, we have had a mental health policy since 2005 and we recently revised it for 2020 to 2030. Despite limited resources as a developing middle income country, Sri Lanka has achieved impressive health outcomes including low maternal and infant mortality rates and higher life expectancy. This success is built on policies of free education and free healthcare, the dedication of healthcare professionals, and a strong healthcare system. Mental health statistics reveal that 1 in 10 Sri Lankans, which means 10% of the population, suffers from a mental illness in line with global status. In our pursuit of creating a compassionate, good-minded society, I, as a Minister of Social Empowerment and Welfare, have taken steps to empower our country by focusing on 5 key institutions: National Secretariat for Elders, Social Security Board of Sri Lanka, National Secretariat for Persons with Disabilities, Samurdhi Development Department and Counseling Department. We have established elderly day centers under the National Secretariat for Elders to combat loneliness among the elderly. These centers offer various activities such as craft making activities that go in line with self-employment opportunities. We have also set up elderly communities across the country to ensure coverage at every divisional secretariat. Our government is committed to safeguarding the rights of the disabled communities through the National Secretariat for Persons with Disabilities. We focus on improving their education and well-being. We are working to address their employment challenges by categorizing their needs and offering education opportunities using new digital technologies. As a nation that provides free community health services, we have achieved a notably high life expectancy for all our citizens, ensuring equal access to the health care. In addition to these efforts, the counseling department that is under our ministry is running counseling programs tailored to various communities by every divisional secretariat office in Sri Lanka. Currently, at least one active official work with these programs for each divisional office in Sri Lanka. Those are working for counseling, especially. To support the financial well-being of our elderly population who has helped to grow the society we live in, the Social Security Board of Sri Lanka has proposed to the government to introduce a contributory pension that is mandatory. There is already a pension plan for government workers, but not for the others who are self-employed. We have amended the necessary laws of grant them a pension from the age of 60. This initiative aims to build a more caring and supportive nation. Furthermore, we have recognized of 30% of failure rates of ordinary level examination in our education system. To address this, we have proposed to the government to introduce a skill-based education system that eliminates subject-based failures, ensuring every student's success. Lastly, we have proposed to the government to implement a nationwide project to introduce the happiness index to the local and blend it more effectively with the day-to-day life of Sri Lankans. Thank you.
Thank you so much, Minister Pasqual. It's really commendable how Sri Lanka is taking steps to address the mental health needs of, yes, children and adolescents, but also older adults. And this group, often overlooked, is an essential component of our discussions on the life course. So thank you for sharing your nation's inclusive approach. I think it's a very important reminder that mental health is a lifelong journey and every age group deserves attention and care.